Since 2006, I've specialized in multi-port and single-port robotic surgery for the treatment of prostate cancer. Robotic prostatectomy involves removing the entire prostate and the seminal vesicles. Once that's removed, the bladder is reattached to the urethra, the water channel. I actually sew them together with a suture or a stitch, making that reconnection. Sitting on the prostate are the neurovascular bundles. These are the nerves that go to the penis to allow for erections. Those nerves are really delicate. They sit on the prostate almost like the skin on an onion. With nerve-sparing radical prostatectomy, great care is taken to preserve these nerves so that men regain and retain this vital function. Similarly, the urinary sphincter sits just below the prostate. We take great care to preserve the urinary sphincter so that men can regain their urinary control. What really distinguishes my approach to robotic prostatectomy is the work I do with single-port, Retzius-sparing radical prostatectomy. This technique not only uses the single-port robot, where we simply go through the belly button with a 1-inch incision, but the surgery is done below the prostate. What does that mean? Historically, traditionally, when you remove the prostate, you come from above the bladder and prostate to remove the prostate from that direction. Many of the vital connections of the bladder to the patient's abdominal wall and pelvis are disturbed. With a posterior approach, all of that is left undisturbed. And the result is pretty incredible early return of urinary and sexual function. 1/3 of our patients achieve essentially immediate urinary control. That means when their catheter comes out a week after surgery, they are essentially dry. That's an incredible advancement. I'm super excited to be pushing that technique further. I think it matters for patients not only to get dry, but to get dry as quick as they can. Robotic prostatectomy is incredibly safe. The complication rate is about 5%, and the overwhelming majority of those complications are easily managed and not serious. This is not a high-risk or dangerous operation. Typically, patients come in the day of surgery. Surgery is approximately 2 hours, and most people stay the night and go home the next morning. They do have a Foley catheter. This is a small latex tube that drains the urine out of the bladder to a small bag. The bag is on the thigh, on the leg. We call it a leg bag, and patients can walk around, get in and out of a car, take a walk around the block with a leg bag. At night, you simply switch it to an overnight drainage bag, which accommodates and holds more urine so that you don't have to empty the bag throughout the course of the night. In 99% of patients, the catheter is in for 1 week. You come back into the office in a week and it's removed. Robotic radical prostatectomy is not a particularly painful operation. You can have some bloating, you can have some mild incisional pain. Most people simply need acetaminophen, aka Tylenol, or ibuprofen, such as Advil or Motrin. In about a week's time, when the Foley catheter comes out, you're going to feel pretty good. You're going to look good. Most people won't know that you had an operation. The recovery then takes about 4 to 6 weeks until you feel basically like nothing happened. That doesn't mean that for 4 to 6 weeks you're bedbound or can't engage in routine activity. You can. You'll have mild discomfort. Each day you'll feel stronger. Many patients can return to work in 7 to 10 days. Robotic radical prostatectomy is an incredibly effective treatment for prostate cancer. Most patients are cured. After surgery, we continue to check your PSA, the blood test that typically leads to the diagnosis in the first place. After surgery, the PSA is typically undetectable, less than 0.01. We watch that at 3 to 6 month intervals, and then once a year. And as long as that number stays undetectable, we consider you cured. A small percentage of patients will need additional treatment after robotic radical prostatectomy, such as radiation. Roughly, this accounts for 5 to 10% of patients who undergo surgery. Being diagnosed with prostate cancer is scary. Not only is it cancer, but there are also potential real side effects that hit you kind of where it hurts, whether it's urinary issues or sexual issues. Since 2006, I really feel blessed that I've been able to help thousands of men with prostate cancer through robotic surgery and get them through it, as they say.